Hello, my name is Gerry Chen. I'm a registered massage therapist, work at TUINA. Hello, this is Gerry. Today I'm going to show some treatment technique I use for the tension headache. Tension headache, it's a kind of like a dull pain around the ear and the forehead and the neck area. This tension headache is a very common situation, happens when people have a stress, depression, overworking, or some trigger point on the back, shoulder, and the neck muscles. So for this treatment, first I'm going to do some trigger point release on the upper shoulder muscles, especially the upper traps area. So when we do this, I first do some muscle stripping on this area. So for the muscle stripping, I first work on the upper shoulder area, especially the upper traps. This muscle located from the occipital until the spine of the scapula. When I do this, I'm stripping along with the muscle fiber. Do some F-rush and patch massage. When I go deeper, I may feel a taut spot and a pain spot right here. This is called trigger point. When I find this trigger point, I'll do ischemia compression pressed on this spot at least for 1 minute. When the pain and the taut released, I will move to the whole muscle fiber, do some F-rush to release the muscle tone. So after the trigger point release, I will do some F-rush on the muscle fiber, release the muscle tone, and after that, I do some stretchings on the upper trapezius to keep the muscle in a good length. Usually, I will hold 15 to 30 seconds. After stretch the upper trapezius, next I'm going to move to the side of the neck. There's some muscles located here. One is scalene, one is sternoclaviculomastoid. Those muscles' tightness also can cause the tension headache. We work on the side of the neck, some group of muscles like SCM and scalenes. Release those muscle tone also can help to release the tension headache. Okay, so next I'm going to put my forearm under the neck area, also do some turning movement. For this technique, I use gravity. Let the cervical spine lie on my arms to increase the space between the joints. Also, I work on the suboccipital muscles to release the muscle tone. During this treatment, also I can do a little bit like flex and rotate to help stretch the suboccipitals. Increase the joint mobilization. Also release the pressure. At the end of the treatment, I will work on a little bit on the jaw area and the forehead area. Do some light massages on this area. Give a little bit pressure on the head. This treatment not only to increase the joint mobilization and release muscle tone, also we can stimulate the nerves and let them calm down.